Young boy Jack Adcock died in hospital in Leicester. It was obviously a tragic case, but also one with implications for medical staff. Today, a doctor and a nurse were convicted of manslaughter over Jack's death, and the doctor is now at the centre of an argument about whether she should be allowed to continue practising. A letter to the Times today from hundreds of medics and others says she should be allowed to keep working. Here's a brief history of the case. It was February 2011 when 6-year-old Jack Adcock, a child with Down syndrome, died of a cardiac arrest at Leicester Royal Infirmary. He had developed sepsis, but it was not diagnosed. And although not a cause of death, Dr. Hadiza Bauer-Garba stopped other staff performing CPR on Jack, mistakenly thinking that he was subject to a do not resuscitate order. For that and other failings, she and a nurse, Isabel Amaro, were eventually convicted of manslaughter by gross negligence at Nottingham Crown Court. They got suspended jail sentences and both were suspended from their posts. But Dr. Bauer-Garba was given a second chance to practice as a paediatrician. The Medical Practitioners Tribunal Service found that there had been system problems as well as individual ones, and thought she should be kept on the medical register as she would not be a danger to patients. The General Medical Council disagrees with that, and the issue is now about to be decided by the High Court. Should she be allowed to practice as a doctor or not? Well, for the many who wrote to the Times, the case criminalises medical error and makes it far harder to learn from mistakes. But let's talk that through. With me are Jack's mother, Nicola Adcock, and Dr. Jenny Vaughan, consultant neurologist from the campaign group Manslaughter and Healthcare. And a very good evening to you both. And I'm going to start with you, if I may.
Okay.
Nikki, what was your reaction when you heard about this letter from really hundreds of medics?
To be perfectly honest, I was absolutely mortified. I was devastated that all these doctors had got together and obviously supported the fact that she'd been charged with gross negligence manslaughter in a criminal court by a jury. We was in court for 4.5 weeks. And I don't understand how a doctor can be charged with gross negligence manslaughter and still be able to work. Where does it give the public any faith, any of the community any faith? And what I'd like to ask is most people out there that's watching this evening, if they took their child to the hospital and a doctor who's been charged with gross negligence manslaughter over the death of a 6.5-year-old son, 6.5-year-old little boy, would they be happy that that doctor is treating that child? It's disgusting. She should be struck off. She's walked away scot-free. She got away with a 2-year suspended sentence, and now she's not even been struck off.
And for
Where's
you,
the
this
justice?
And justice for Jack is
Absolutely.
a slogan, because you're trying to collect signatures and campaign on it.
And all of these people that have got together, yes, they're doctors, but put it as they're parents as well.
Now, does it make a difference that a lot of people have said, look, there was a lot going wrong at the hospital?
No, there wasn't, and I want to clarify that and clear that up. I need to make sure that people out there understand this was not a system blunder, this was not a system error. This doctor, as they've linked it to a petition, was a trainee. I just need to clarify that she was actually a level 6 registrar, which meant she had lots and lots of training on that day. Where she messed up was basic things, as in cold hands, cold feet, giving him the correct bolus fluid. He had a heart condition. She never contacted Glenfield once, not flinching when they put the needle in.
And you think it was like 10 to 20
I've
mistakes?
I've literally wrote down 20. I can give to you now.
One quick, sorry, Nick, we don't have nearly enough time, but would it make a difference if doctors could persuade you that we would save more lives?
It's rubbish.
By learning from mistakes and not getting people to be defensive or
Okay.
covering up their mistakes.
Can I just ask then, so if I was to go out in my car and I was to run somebody over, I'd get charged with manslaughter. I would go to prison, I would lose my licence. This was not a system blunder, this was 21 plus errors she made that day. I understand we are all human beings, we all make mistakes. 1, 2 maybe, but not 20 plus. It's not acceptable. She even got him mixed up at the end of the night with another child who was a do not resuscitate. When asked in court, how did you get a Down syndrome child mixed up with a normal child? Her question was, I didn't look at the child, I got the parents mixed up. So if that's not neglect, that's definitely not a system error. What is?
Nikki, thanks. We'll stay there. Jenny, obviously this is a tragic case. Yeah. What is the reason? Because you've heard the argument.
Absolutely.
What is the case for saying you would employ this person as a doctor after a big blunder like that?
Well, I'd just like to say that I work with many bereaved families, and I really respect Nikki coming here, because this is, you know, she's lost her child, and I'm not in that position. But Dr. Garber worked. The reason that the MPTS felt that she shouldn't be struck off was that they absolutely found there were systems failures. There were over 70. There were over 70 systems failures identified by the hospital, and they were all enclosed in their serious untoward incident report. And actually, the jury didn't hear about all of those. And when we talk about system failures, we mean things going wrong on the day. Hospital results, the results, all their normal ranges didn't come through. There was a lack of a senior alert system. There were failures at every level. Right. There were failures on trainee supervision, senior supervision. There were lots of different failures, over 70 failures.
So I think we see the geography of the argument about how you apportion blame. I'm sort of interested, though, in the bigger picture of what is your worry about what happens to medical professionals if you know, doctors are struck off for this kind of thing.
Well, I think it's sad. We're actually all on the same side.
No, we're not.
Doctors are on the same side as patients here. What we want is a safe culture. And the only way you really get a safe culture is actually a no-blame culture, where people can be frank about the errors that they made and they can discuss them and not feel challenged, and that they come out in the open and say, I did this wrong. That's the only way that you actually improve patient safety.
You would agree that there are some errors that are too gross to such gross negligence. You would say, sorry, you're just obviously not fit for this job.
Yes.
Doctors get struck off for fraud.
But in this particular case, the MPTS has heard all the evidence. That's the tribunal.
I mean, they did find, in fairness, they did find that there were grotesque errors. I mean, on the day, and they said it was the fact that she had redeemed herself by trying to...
She did nothing that was... She has had honest failure. And basically, honest failure should not be rewarded with punishment and retribution. She has been suspended. She's had trial by media. A lot of things have happened.
Would you let her... This is Nikki's question. Yeah. Would you let her look after your child?
I absolutely would.
Rubbish.
I absolutely would. And I'll tell you why. Because actually, through all of this, we are on the same side as patients. And I would say to her, before all of this and after Jack died, she did show that she went on courses, she showed remediation, she did show that she had insight into her errors, and she expressed that. So I would have no trouble in actually having her look after my child now, because she has shown insight into those errors. And that's for the whole profession. All of us need to have an open culture where we come and express errors. Otherwise, patient safety simply won't actually improve in the future.
OK. Well, look, before I come back to you, Nikki, I want to say we should... Dr. Garber hasn't herself been able to respond to what the discussion is here today, but we did make contact with her solicitor, and she gave us a statement, and she said, no words will ever bring Jack back, but I'd like to apologise once again...
That's the first time.
...to his family for my clinical failings in his care. I think about this tragic case every day with regret and remorse, and if I could turn back time, I would do things differently. My thoughts are with Jack's family. And I know that you feel you've never had remorse. She's never shown remorse.
In court, she's never shown remorse. She's never said sorry. As far as I'm concerned, she's got a heart of stone.
And it would make a difference to you if it...
Not now, it's too late. You know, at the start, when we was in court, there were nurses on the stand as well. Everybody that took that stand was so sorry, was so remorseful, I mean, the nurse...
And I know others have said she did have remorse.
Yeah, well, that's just because they're doctors, aren't they, all clubbing together again? I mean, can I just say one thing?
Last comment,
Yeah,
Nikki,
can I just say one thing? I don't have any issue with any doctors and nurses out there. There are amazing doctors and nurses out there. This is just my thing about the one doctor that, you know, neglected my son that day. I don't want another family to go through this, and I wouldn't wish it on my worst enemy.
And we don't either, which is why we want everybody to actually have an open, just culture.
Everybody agrees.
We don't want this.
Jenny, thank you so much. Nikki, thank you very much.